We've got a breaking report at this hour of a second member of Congress who's tested positive for coronavirus, Congressman Ben McAdams of Utah. He announced it tonight on Twitter. McAdams says he self-quarantined the moment he developed mild cold-like symptoms, continues that isolation now that he is tested positive. And even as the pandemic reaches the halls of Congress, other parts of government keep truly focused on the wrong things. Just 2 days ago, on the first day of the coronavirus lockdown in California, Immigration and Customs Enforcement officers were out conducting raids in L.A. County. Look at this headline. With masks at the ready, ICE agents make arrests on the first day of California's coronavirus lockdown. As the public health crisis is becoming increasingly clear and urgent, ICE has continued not just to apprehend people, but to distribute them in detention centers around the country, processing them and then flying them, driving them to other facilities. Immigration attorneys are ringing alarm bells. This will accelerate the public health crisis in our midst. And that does not count the over 2 million people currently incarcerated in our country in prisons and jails that are notorious vectors for infection. Think cruise ships, but without access to soap or sanitary products for the inmates. Tonight, we have a report from the New York Daily News of an inmate at Rikers Island Jail Complex in New York who has tested positive for COVID-19. Rikers is huge, one of the largest correctional facilities in the world. Right now, unless dramatic steps are taken, there are enormous public health consequences for everyone detained in these facilities and outside of them. Joining me now, someone who knows firsthand what it's like to make major health decisions for detained populations, Dr. Jonathan Giftos, the former medical director for Correctional Health Services at Rikers Island. And a reporter has been focused on some of these especially vulnerable populations, the great immigration scoop machine, Hamed Ali-Aziz from BuzzFeed News. Hamed, let me start with you, because even since that script went into my prompter, there's been news. There's some announcements that basically ICE is going to suspend a whole lot of their enforcement. Is that correct?
Yeah, I mean, there's signs that they're beginning to pare down some of their enforcement activities. They announced late tonight that they will delay arresting immigrants who are not public safety threats and roll back detaining those who fall out of mandatory detention guidelines that are actually set by Congress. So this is actually a sign that ICE is starting to, like I said before, pare down some of its enforcement.
But just in the last few days, I mean, you've reported on this and I've talked to sources on this where immigration court, just people packed through, apprehensions, and then people being distributed across the country to different detention facilities.
Sure. Yeah, that's still going on. The Department of Justice has been dealing with this issue by shutting down several courts. Starting every night, they're announcing that they're, postponing more hearings. So this is a sign that the system, the immigration system, is, really trying to prepare for, worst case scenarios.
Jonathan, I've been hearing from folks who are advocates, public defenders, medical folks like yourself about the threat in jails. Explain why it is so acute.
Yeah, thanks, Chris. Jails simply cannot protect patients and staff from a pandemic affecting the city. Jails are not closed systems, despite what people may think. There's tremendous flux of people in custody, as well as 24/7 healthcare workers and officers who are coming to staff 3 tours a day. Mitigating efforts such as physical distancing are nearly impossible in jails. Frequent hand washing is impossible in jails. And despite the heroic efforts of healthcare workers, screening and isolating people who are symptomatic is impossible in jail. Couple this with the fact that jails are known to have in their custody some of our community members at highest risk of complications of coronavirus infection, specifically people over the age of 50, of which there's actually almost 1,000 people in the New York City jail system right now over the age of 50, as well as people with compromised immunity. It's a recipe for disaster. It's my view that the only way to really mitigate the harm of a rapid spread of coronavirus in the jail system is through depopulation, releasing as many people as possible with focus on those at highest risk of complication.
What do you say to people who hear that and say, oh, no, you're just going to, quote, release criminals out into the streets and at a time of social disorder? What is your response to that?
I worked as a doctor for 4 years caring for people in the jail, and I think that many people who are in custody return to their families when they leave. 72% of people in my program as the director of addiction medicine when I was there had their own home to return to. People have jobs and families. it is simply not the case that people will be leaving jails for the streets. While some people do struggle with housing and other things, it is simply not possible to keep people in the jail system safe at this time.
Hamed, my understanding is ICE has represented to Congress there is no one in their custody who has tested positive, which I think is a little hard to credit. Is there any evidence that they are putting any systems in place for health care that is going to be immediately necessary in these facilities?
Well, they've been releasing statements daily saying that they're taking it very seriously. They have their high-level experts monitoring best practices. They've changed the way, folks are, brought into the facilities, screening them before. But obviously advocates, are pushing for those who are suffering from medical issues and who are elderly to be released to protect them from, the potential spread of this disease. So.
Jonathan, the question about release here, and I've heard the same thing, sort of depopulation is a key. And I think you make an important point I just want to stress, which is even if people are not morally persuaded that these are human beings who do not deserve to be left to a pandemic, it's not some other population over there. Like there's CEOs who are cycling in, like it's not going to stay in Rikers, right?
Right.
In terms of the prison population broadly, and we're talking about, it seems to me the lowest hanging fruit is we have a lot of senior citizen prisoners who we just know statistically are not recidivism risks at all. That seems like the most obvious start here.
Yeah, it's true that the prison population has a lot of people at high risk of complication. I think that the reason we're focused right now on the jail population is that because of the flux that we talked about,
right,
but also because of the fact that people pre-trial, people in on short city sentences, and people in on a violation of parole, there's very easy and quick mechanisms to release people. And given a pandemic like this where there's spread and new infections at exponential rates, urgent action is really needed. And I think that that's most feasible right now in the jail system.
So you think that there are ways to sort of targeted quick things that could be done by this? Would it be the city or other cities around the country to do that sort of reduction?
Yeah, I think I think if parole is a state is a state run organization, and so lifting warrants on people on parole is done at the state level.
Yeah.
But for people in on city sentences or pre-trial on felonies, that's done at the local level with DA's offices and judges.
All right. I hope DAs and judges are listening. Dr. Jonathan Giftos, Hamed Ali Aziz, thank you both.